cancer is commonly caused by sun exposure. There are some very rare conditions where people can have it that run in families and they can get multiple skin cancers, but the vast majority are caused by sun exposure. And there's two different types. One is sunburn, particularly sunburn as a child, and that predisposes more to the melanoma type of skin cancer, which is the more serious type of skin cancer that you hear about in very hot climates like Australia and what have you. That's why they make a big thing about, making sure your children have got proper sun protection and you don't get sunburn, because that can damage the skin and that can predispose to melanoma skin cancer. Non-melanoma skin cancer is also sun exposure, but it's more chronic sun exposure. So wherever you are, we're exposed to the sun throughout our lives, and it's the chronic sun exposure over years. So the non-melanoma type of skin cancer is more likely to happen in later years, later on in your life, because you've had such a long time of being exposed to the sun. And that's also why it's more inclined to occur in sun-exposed areas. So classically, the face is a classic area where you will have a BCC or an SCC due to the long-standing build-up of the sun exposure to those areas. So the thing you've got to look out for is a change. That's the most important thing. You're looking for a change in your moles. So that means if it changes in size, that means if it gets bigger or smaller, if it changes in colour, if it gets darker or lighter, particularly if it starts to bleed or itch, if you get any other little moles appearing around the outside, if there's a change in any way, that's what you look out for. So that's why it's important to keep an eye on things and to have a baseline. So have a look, check your moles, check your skin now. If there's any you're worried about, get them checked out now. And then once you're there, then you've got a baseline to move forward with. And if you have any changes, we've got a guide on the website you can download to the outlines of changes. But broadly speaking, if you have any changes, get it checked out. It doesn't necessarily mean that it's gone cancerous, it just means you need to get it checked out. So keep an eye on things, be vigilant. The vast majority of skin cancers are diagnosed by the patient rather than the doctor. And what we're looking for is we're asking you about, are you worried about any of your moles or any of them changed? And if they have, those are the ones you need to really look out for.